Hi, Matthew Holt, another THCV Spotlight here. I'm with Aniq Rahman. He is the CEO of Fabric Health, which is relatively new but has a bunch of companies in it that have been around for a little while, some of whom I have featured at the Health 2.0 stage, and some of whom I'm interviewed on THCV. Aniq, welcome and tell me, what is Fabric and what's in the fabric?
Hey Matt, thank you so much for having me on. I feel like I'm a long-time listener, first-time caller here, so it's great to be here. It's
That
great to
probably
meet
indicates
you
the show is
over.
about to end, I would think. I don't know.
Yeah,
I hope not. Anyway, we'll go.
no. It was good to meet you at Health, and it's odd to meet somebody over Zoom after you've met them in person these days.
Yeah, it's the
But
other way around usually. I
yeah,
agree. Yeah.
yeah, exactly. No, it's great. It's great to be here. So, um, quick backstory on Fabric. I started the company about 3 years ago, a little over 3 years ago now. Actually, will be 4 years in January. Hard to believe. Um, but um, prior to this, I started and sold a few businesses. The vision behind Fabric really kind of came out of a personal episode. My dad had a heart attack in 2018. He's fine now, but had an emergency bypass surgery, and that was really the front row seat that I had to acute care in hospitals and health systems, and kind of got me fascinated, kind of being in the software and enterprise software world my whole career. One, just sort of seeing the miracle of modern medicine, seeing my dad kind of come out of acute episode, but also seeing um, just some of the chaos and dysfunction and complexity really of the acute care world. And so um, it got me really spending time thinking about healthcare. Probably about 1,000 conversations much like this with doctors, nurses, hospital administrators, people in and around the healthcare world, healthcare founders, investors. And it really kind of got me thinking about um, one, the acute care world. How do we make hospitals and the health system better? But two, it kind of got me thinking about the patient experience and the patient journey writ large. And so Fabric is kind of the culmination of a lot of those conversations coming together. We started the company in 2021, really focused on thinking about how to tech enable the emergency room experience, and really, that is really an entry point for a lot of patients as one of the front doors to the hospital, so to speak. Um, but then we realized, a lot of and we've done some really great work there in helping kind of tech enable the in-person experience for patients in the emergency department, helping, speed up ER visits, helping save nurses time. But what we also realized is a lot of the patients that are showing up in the emergency department don't necessarily need to be there. And so people are showing up with these like lower acuity virtual urgent care type chief complaints. And so that actually led us down the path of acquiring our first business last year. We bought a business called Zipnosis in the virtual urgent care space from a publicly traded payer, and that gave us a platform to one kind of get these patients further upstream and help for patients that are showing up with kind of more of the run of the mill urgent care type things, coughs and colds, UTIs, um, things of that sort, tick bites, eczema, lifestyle illnesses as well. And um, and then we kind of continued down that path. We acquired a business called Gyant at the beginning of this year, which gave us capabilities in symptom checking and conversational AI to help route patients to the most appropriate site of care, whether it's virtual or in person in a place like the emergency department. And then have really kind of grown the business even further. We've made two other acquisitions that we've announced. We bought Walmart's virtual care business from them earlier this year over the summer, which is MeMD, which is largely focused on the employer segment. And then we also acquired Team Health's virtual care division from them, and that gave us a 50-state provider network and brought us a network with a bunch of payers, and has given us a bunch more resources to sort of scale our virtual care footprint. So now we've really become more of a full stack player now, helping everything from, if you think about what Fabric is in totality, it's everything from helping patients with um, the conversational assistant, routing them to the most appropriate site of care, helping them check their symptoms, helping them get care through our virtual care software platform. But we also have the clinical network. We have our own 50-state PC that can help see and treat those patients. It's a multi-specialty medical practice. So it's virtual urgent care as well as behavioral health. We do talk therapy, we have psychiatry. We also have products to help with longitudinal follow-up patients. So we have a pathways product to help follow up with the patient coming out of the hospital or after the ER, making sure they don't bounce back to the hospital, for example. Um, and we're building a lot of other capabilities now around access as well. So one of the new things that we're going to be sharing a lot more in the new year is that we're building capabilities around patient scheduling and provider directory, which is again part of that access piece and making sure that patients are able to see a specialist or get a primary care appointment and not get lost in the system.
Great. So you've got a lot of pieces there. So, and I think there's a consistent question when you have, especially when you have kind of your background, right? To be overly stereotypical, tech bro has healthcare experience with dad, goes into healthcare to fix stuff. Where do you aim what you've got at? I get the whole piece around doing a lot of different parts around the virtual care continuum. Yeah, if you start in the emergency room, there are people there who clearly, didn't need to be there. Zipnosis for a long time was doing the kind of asynchronous prescription stuff. You've got MeMD, which does it more real time. You've got, I don't know what the team health part does, but I assume it's the same capabilities with more doctors and all the rest of it. So now you've got the ability to have a sort of virtual stack that deals with patients who have, I assume, chronic and also ongoing minor acute episodes. There's probably a big question which everyone like in your position is faced, which is where do I go? Am I building my own medical group and taking on the current healthcare system, or am I going to the place like where my dad ended up? I don't know where your dad ended up, but it was probably with probably a well, I would guess if you're in New York, a well-known sort of, Fifth Avenue, one of Upper East Side clinic or, clinic or hospital, whatever, do I go to them and try to help fix their process? So I think you made a choice on that, but how does what you are putting together help that choice? So tell me the choice, and then tell me how you think you're helping the choice you made.
Yeah, absolutely. So first off, very fortunate to sort of have this background in technology, but we have a team of physicians, nurses, informaticists that are working day in, day out to build this. And so, I think part of what we wanted to do is make sure that we're not building in isolation, sitting in the garage and sort of dreaming up the next big idea that's kind of divorced from reality.
We will not bring
Um,
Adrian Aoun on this show to talk about. He'll tell you you're wrong, but that's by the by. But keep going.
yeah.
$500 million
Well,
failure to tell you you're wrong, but that's a separate issue.
um, and in the case of my father, he was incredibly fortunate to get great care, and I just saw him for Thanksgiving last week. So he's doing great. But he actually didn't get care in a fancy New York City hospital.
Okay.
I grew up in a small town, college town in Oklahoma. My father got treatment at a couple of community hospitals down in Oklahoma. Um, and so I think for us, we're very fortunate to be able to serve a pretty wide range of institutions. Today, we're working with about 80 health systems across the country. Some of those are larger kind of academic or for-profit institutions. Many of them are smaller, rural community hospitals, nonprofits as well. And so to us, it's all about kind of creating that, really kind of democratizing the whole experience for patients, regardless of the entry point, and also making it a more seamless omni-channel experience. So whether or not the patient's coming in, via phone, video, voice, chat, async, or in person, we want to help tech enable that experience and make sure that's a more connected longitudinal journey. And so I think you bring up a very fair point though, that like we're doing a lot. I think part of the issue that we noticed in healthcare coming into it is that there are all these companies that have been funded or venture backed, et cetera, that have really focused on a very narrow sliver of healthcare. And so, you know, there's so many symptom checker companies out there, for example, but patients go through, answer 20 questions, and then they get dead ended. There's no like opportunity for them to schedule the appointment or see the provider or take that data that they entered into the symptom checker and send it to a doctor, for example. And so what we've done is we've wanted to kind of create this more connected ecosystem for patients where you can start with the symptom checker, for example, and then have those responses actually get sent to a provider if you're eligible for virtual care. or get routed to the emergency department if that's actually where you should be going, um, or get an appointment with a specialist if that's the right place for you to go. And so part of what we want to do is make sure that patients are able to go do that without having to log into 5 or 6 different point solutions, and kind of unify that experience. Which I think is much easier said than done. In order to do this, we've again been fortunate to have raised capital from some amazing firms to enable us to be strategic in acquiring some of these best in breed point solutions and then putting them together under the Fabric platform. And so part of what we've done is, one, scoured the market looking for some of these companies, um, really understanding them, speaking to their customers, understanding these pain points. We've also gone through the pain of trying to build some of these things ourselves. So we knew just how difficult it is to build something like a Zipnosis or a Gyant. Um, and then we've also, I think, brought together very like-minded people that are very mission-oriented, mission-driven, and sort of being able to sort of think through how do we, create the best possible patient experience and integrate with the core systems of the hospital. Like we haven't set out to, build an EMR or build, some of these other, Ford's a good example of a company that tried to reinvent everything. They signed the leases, they built the hardware, they built the software, they hired the doctors. They did it all kind of really full stack, which worked up until it didn't. But I think what we've tried to do is take a more pragmatic approach in terms of building the things that we're definitely building a lot of really great things, and but we're also being able to, we have the advantage of being able to build with a really strong basis of customers and a really strong base of technology and a really strong team, that allows us to kind of create net new products that integrate into the platform vision of Fabric writ large.
So two questions following up that. One's fairly obvious. So you bought a bunch of people who had customers already, presumably, I assume, with the intention of saying, "Great, now you've got this one piece of us. Here's this other thing which we have as well. Can we expand into that as well and help you with a raft of other problems?" How has that sales process gone?
It's been great actually. So I think part of it was we got fairly lucky that Zipnosis and Gyant had actually been partners for years. They'd had
Yeah,
a couple of mutual customers. They'd had done um, product development together. And so the companies actually knew each other very well. It was like when the deal sort of started coming together, we got the management teams together and everyone just kind of hugged and said like, "Oh yeah, it's good to see you again." So it
right.
wasn't like it wasn't a completely sort of foreign marriage. Um, with and you're right, like it's given us kind of this distribution as well because there's as you know, selling into healthcare is difficult. And today we're selling into health systems and other provider groups. We sell to urgent cares, we sell to payers, we sell to employers. We're starting to work a little bit with pharma and life sciences. And so, getting that distribution to us has been a pretty nice unlock and being able to sort of accelerate our growth because now we have a base of customers that are familiar with one or two or multiple solutions that we have, but today we have several solutions that live under the Fabric umbrella, and we can kind of go in and tell them like, hey, rather than having to onboard yet another point solution and integrate them, you can actually work with Fabric and we can scale horizontally and help kind of meet new business challenges that you may have.
So the flip question of that is, and I don't know how you're doing the excuse me the sort of the white labeling versus the branded part, is that when they see, great, you've got a stuff, something that fixes our emergency room, or you've got something that's for our front door of our website. But now you've got this other thing which looks like you're sending our patients to your doctors over here, in this virtual solution. How are you managing that piece with them to make sure your customers don't think you're going into competition with them?
Oh, absolutely. So yeah, we're very much B2B2C. So everything that we build on the software side is completely white labeled to match, the look and feel of our customers. They can
Right.
actually, completely customize everything. We have an API that they can integrate with. We have some customers where, you go to their website and you don't even know that it's powered by Fabric. It's just,
Sure.
just running. In terms of the staffing component, most of our deployments are actually staffed by the health systems
Okay.
providers, right? Um, where we can help augment though is on for nights and weekends coverage, for 50 state coverage, for holidays, for wherever they need additional sort of coverage. And so, it's not meant to be competitive with them in any way. It's actually meant to sort of extend their
Yep.
ability because a lot of these health systems we work with are, they may have 10,000 providers, but they're all really licensed in one or two states, and they have, even their own employee base is national at this point. And so, let alone, their patient base is in New York, for example, you have a lot of snowbirds, you have a lot of people that are kind of, in and out of the city. So being able to kind of provide that as a value add is something that I think allows you to have a more full stack experience. And there's been precedent now with a lot of telehealth companies that have built both the software side and the services side and do it in a way that's not in competition with their customer base. Um, on the employer side of the business, we are staffing 100% of those visits with our providers. And so today, we actually provide virtual care to about 30,000 employers across the country. And so, again, we were fortunate in being able to acquire this business from Walmart when they announced that they were shutting down their clinic business and they're kind of exiting, parts of their healthcare business. Obviously, they still have a pharmacy and a lot of other things, but um, we, as we brought this on board, the MeMD team and the MeMD customers and technology, we realize there's also a lot of synergies in terms of the medical group that we have, in terms of the software, in terms of the clinical protocols, and in terms of the team. And so part of what we're excited about is being able to introduce things like asynchronous telemedicine to this employer segment, which employers and payers are very much kind of focused on. How do we reduce the unit cost of care delivery? How do we make care more accessible? How do we basically help our employees and dependents avoid high cost settings. And so we think that asynchronous virtual care is basically as good as it gets there. It's a way to kind of create scale. Today we've had over 6 million patients go through and get a virtual visit on our platform. Um, and we've seen that the average physician work time or provider work time, it could be staffed by an APP, for example, is only a minute and a half to do the full triage, evaluation, diagnosis, and treatment, because so much of this can be done with, again, it's a very strong set of physician-driven clinical protocols. This is, this is not to use your words earlier, like, a bunch of tech guys just kind of getting around. This is very much kind of a highly vetted set of clinical protocols that we've built that are reviewed and updated by our health system partners for the most part. So we have about 18 chief medical officers and medical directors from across the country that serve on our clinical quality advisory council that are reviewing all of our protocols, making sure that we're practicing the latest and greatest in evidence-based medicine. Um, and again, their own providers are practicing under those protocols as well.
So, no, and I think I was teasing you, but I get that, and I think this is actually unfairly labeled against a lot of startup companies that say, oh, they have no clinical background. Yeah, there's usually a lot of clinical background, a lot of clinical help going into these companies. And obviously, if you have 18 chief medical officers from across providers across the country, reviewing this stuff, you've got a lot going on. Does lead me to another question, though. You're now talking about servicing employers, servicing consumers, servicing providers and maybe payers as well. The market for getting care is complicated, right? So you've got a few now apparently successful, mostly because of GLP-1s, direct-to-consumer plays. You've got a few, and the Hims and Hers and Rows of the world. You've got a number of people who are, by and large, if you go on your health plan site, you can get to a virtual care platform that way. The majority, I would say, if not most, of providers have got someone like you doing something either in the background or in the foreground, helping with virtual care. And most independent doctors now have got, are able to do telehealth or some version of that. They may not have asynchronous down, but they've got something like, Doximity or DoxyMe or, Zoom or whatever to do this. And you're seeing in a few areas, mental health, of course, where, live and asynchronous care really taking off on the telehealth side, less so on the on the regular sort of a medical side, but still much more presence than it was pre-pandemic. So I guess my question is, where do you think, just speculating, you're in multiple of these markets, and I'm sure you're prepared to serve whoever wins. Where do you think most consumers are going to end up, getting their entry point? Do you think it lives with a provider, lives with a payer? Do you think it's whoever their employer shoves in front of them? Where do you think this ends up?
I think at the end of the day, patients are looking for convenience and they're looking for access and cost. So if it takes you 6 months to get an appointment with your primary care provider, you're probably going to go seek alternatives, right? In New York, there's an urgent care on every corner. It feels like, as you mentioned, you can get virtual care through a variety of means. Um, there's also a large population in the United States that doesn't have insurance, and so
Sure.
offering asynchronous at competitive cash pay prices is, I think, a big opportunity, and especially as more and more people are on high deductible plans and on self-directed plans. I think that being able to kind of compete and provide high quality care at a low cost
Is
to
that is that
capture
something
consumers.
you're doing now, or through one of your partners?
So, all of our health systems generally offer this as a cash pay, offer the asynchronous piece of the cash pay
Okay.
benefit. And it depends on the market and how they've priced it, but some of them price it as cheaply as $20 to $25. Some
Yeah.
of them, are $50, $75, but it's certainly much cheaper than going into an urgent care, certainly much cheaper than going to an emergency department. Um, and even for the urgent care customers that we work with, many of them know that they need to compete on price. They need to compete on experience. Today, a consumer can just go on Amazon, go to One Medical Amazon Clinic. They can go get care through all the various entry points that you mentioned. Um, I think we've taken a more agnostic view to it. We want to basically work with everybody in the market. We want to be an enabler for the health systems, for the payers, for the employers, for solo providers. We have solo providers that sometimes just buy our software to help tech enable their practices. In fact, we have somewhat famously within the company, we have a solo nurse practitioner in Alabama who started her practice using our software. She basically bought Fabric's virtual care solution and paired it with her EMR and runs a subscription concierge direct to primary care type practice now. And it's grown tremendously to the point where we've now hired a few people and so those are the stories that I think get us excited because there's a need for technology to make any of these care venues more efficient, to give these providers time back, to compete with the consumer experience that a patient's getting on from a Row or Hims or Amazon. And it's not something that you get out of the box with the standard defaults. You can do telehealth on Zoom, but it's going to take you 10 or 15 minutes to treat a cough or cold potentially, and then you still have to go through and do the documentation. You still have to deal with the payment collection piece. We want to make that easy for you, and so kind of doing that as a one-stop shop, and we can even staff it for you if you need. I think is part of the value that Fabric brings to the table.
No, it sounds good, and I think it's an area that a number of people are now helping. There are folks like KeyCare as well are kind of helping systems compete in that world as well. Okay, so a couple of last questions. You have money from Google Ventures, but also from General Catalyst, who famously have bought a health system to allegedly, well, I'm not quite sure why they've done it, but maybe they've told you to help, but allegedly to help, experiment with and figure out which kind of solutions that they have invested in might work with their new health system in Ohio. So, what have you been told about that, and what if any plans have they and you cooked up together for that, or is that something you're looking at from the outside?
Yeah, I mean, well, I can just comment. Summa has actually been a customer of Fabrics for a while now,
Oh, pre
predating
pre
even
pre pre the Hatco thing. So,
yeah,
okay.
predating the General Catalyst announcement. I don't know, what the latest is there. I know that I saw some press the other week saying that they'd signed the agreement and it's kind of gone through that next phase. But I think it'll still probably be next year from what I'm
Okay,
gathering.
I'm upset. I thought there was a secret cabal of witches and wizards with, Hemant and Aja stirring the cauldron in the middle, explaining how they were going to do the whole magic thing and turn it into Hogwarts Part 2 or whatever. But no, well,
Yeah,
that's disappointing. When that does happen, I expect you to come back and tell me. All right.
yeah. Just as a industry observer, I'm really excited about it. I think um, it's a big swing. It's one of those opportunities to really kind of bring engineers, product managers, data scientists, designers to the front lines of healthcare problems in an acute care setting, in a community that has is very dependent on that health system and health plan. And it's just been really exciting to collaborate with GC, just generally speaking. Even outside of the Hapco piece, because I think they are really trying to sort of take, they for context, they led a $60 million Series A round in Fabric at the beginning of this year. That was really kind of ammunition to allow us to go acquire a few companies, to really grow, to frankly, they've opened up their network to us. They've been fantastic partners, and we're continuing to grow the relationship and scale with them. As you mentioned, we also work with Google Ventures, and Thrive Capital has been another great partner of ours. Actually, Thrive led our seed round. A lot of those like 1,000 calls that I was telling you about at the beginning kind of happened with me just sitting in Thrive's offices and getting connected into their network as well. So we've been very fortunate in having some great capital partners backing us from the beginning.
That's great. So, two things from the total number in so far in terms of dollars. You mentioned
So
60.
so we've raised 80 million of
Okay.
capital so far. We came out of the gates with a $20 million seed round, which is certainly a large
Nice.
seed. Um,
Compared to
but
something like scraping around for their $1 million seed round, that's a good deal. But
yeah, well, I also been fortunate in prior ventures and self-funded the business to get it off the ground, and so it allowed us to kind of um, you know have a little bit more substance than the typical
yeah.
seed. But it's still early days today. Almost four
Well,
years in, it's
I
still
mean,
pretty
look, and
early.
that is a consideration because I mean, I know it's this year, it's a little bit different than we were in 2021, but I mean, you have seen, we mentioned Ford, you can mention Olive, you can mention a bunch of people who raised a ton of money and haven't found that exact market, business market fit, right? And I have to say, it's a one of these things where the people who try, and I'm not sure quite what Oliver was trying. There's some of the inside there, and it was not quite sure what was going on, but in general, the people who tried to come at it from the outside have not done as well as the people who said, okay, we're going to figure out a way to cooperate with the incumbents, which is good and bad because it means you do end up participating, perpetuating the incumbents in the American health system. But hopefully, some of this technology is making them better. And given the experience many people had over the years with, the incumbents and their lack of innovation, their lack of customer sort of their poor customer experience. I'm happy that someone's trying to fix that, right? That's good. On the commentary over on the scale, you mentioned you bought these 4 or 5 companies. What's the state of how many employees do you have? How integrated are those products now with each other? I mean, how much, there's obviously work to be done, and that you mentioned some of them were already talking and already partnering before. But I mean, how many people and how close are they to being sort of one platform, one fabric, rather than 5 companies hanging out together, emailing each other, asking
Yeah,
what works?
yeah. So I think we're definitely one fabric. We're all organized as one company. We have one team, one leadership team that everyone kind of rolls into. Um, and we've also been very deliberate in making sure that we don't have like 5 engineering teams. It's like one engineering team, one product team, one design team, one customer success team, one sales team. It's all part of part of the company together. Um, in terms of the integration process for us, when we buy a company, we generally try to make sure that um, we can really kind of integrate as quickly as possible, because I think having been through acquisitions myself, sitting around for a year or two waiting to sort of figure out where people go and how customers are going to be communicated with and things of that sort is not really good for anyone. And so part of what we've always endeavored to do is kind of um, be a good steward of the technology and the teams and the customers and make sure that there's clear communication, that things are, and I think we're definitely learning with each one of these. There's definitely things that we could have done better or things that we could have optimized, but by and large, we've been forced to learn quickly because we've done four acquisitions. We did four acquisitions in basically an 18-month time period. Um, One of the benefits with the Team Health acquisition is that we didn't have there wasn't any technology per se there. So it was a medical group that we brought over. So that was a relatively simple integration. Um, the Gyant and Zipnosis acquisitions I mentioned, had a lot of structural overlap and good team dynamics. And so we were able to kind of bring those teams together, and the products already had an existing product integration, which we've been able to grow and strengthen. Um, the MeMD acquisition was definitely open to bring us into a new space. And there's some capabilities that EMD had that we didn't have in the Fabric platform. So there's certainly some ongoing integration work that's going on there. There's some customer migration, technology work that we're doing there. But by and large, it's been I think a pretty good transition. We've been really kind of working to make sure that it was just business as usual for customers. We've kind of kept everything largely the same, and then we're working on adding some new upgrades and enhancements to the platform, migrate customers over the course of the next year for the most part. Um, and then in terms of how this has all kind of come together for us, you know, some of it's been very opportunistic for us in the, again, you mentioned 2021 versus today. I think in 2021, it would have been pretty hard for us to execute on this strategy of being able to kind of go in and acquire some of these businesses. First off, they weren't for sale, and I think for us, like being able to kind of find these kind of best in breed companies, bring them together under one roof, um, was sort of a combination of market timing, having access to capital, and then frankly, like being able to have some success in being able to do these in succession. I think with the Zipnosis experience, at the time when we acquired the business, we were only 8 people at Fabric. Um, you know, we we today we're a little north of 200 people, FTEs, and then we've got another couple hundred, um, you know, 1099 clinicians and contractors. And so, in terms of the base of the business, we've grown a lot in less than 2 years. Um, but it's been like a mix of organic growth. We've been hiring a lot, and a mix of the inorganic acquisitions that we've been able to do and kind of bring the teams together.
So two quick questions. I'll ask them together. One is, okay, code, your 2021 to now is code is stuff is much cheaper and more available. A lot of stuff was built that didn't do that perhaps didn't sell as well as it should have done or got very, there was lots of competition, so you can find stuff to buy. And the second, the related question is you've obviously now you're working with a lot of health systems. Presumably they're asking you questions about can you do this, can you do that? Where do you think the next areas you're going to look at are to spread from the sort of virtual care system that you've been putting together?
Yeah, so like I said, I think continuing to sort of make investment with our health system partners, and payer partners and employer partners is has been great because a lot of them are actually asking for similar things. They all want access. They want so the provider directory example that I was sharing with you really was born out of conversations with a health system that we've gotten to know, and we kind of showed them all the things that we're doing. And they're like, yeah, we want to do all of that. But, today it's like very difficult for patients to even find a provider and schedule an appointment. Like we need to sort of figure out some of these foundational building blocks to the system. And so we've been working really closely with a couple of initial design partners, building that out. And again, next year, I think we're going to continue, we're going to be kind of making some more waves on that. Um, when we look at the virtual care space as well, there's, if you look at where we were even earlier this year, we didn't have the medical group, we didn't have behavioral health. We're going to, I think, continue to sort of make investments in virtual care. I think it's, again, the market has largely corrected from some of the 2021 peaks, 2022 peaks. But I think virtual care is here to stay. You know, I have two young kids. I feel like we end up using virtual care more often than not, just because there's always something kind of that's been brought into the house from their schools. Um, and then I think the other thing is as we're continuing to sort of evolve, as the health systems themselves are continuing to evolve. Um, Many of them are looking for ways to sort of um, change their business model to some extent, from being more of this like reactive sort of fee for service um, venue to certainly, expanding more on the value-based care side, but also expanding more into the concierge medicine side. We're seeing some of our health system partners really, experiment with things like subscription offerings to make it more direct to consumer like, where they can kind of compete with the One Medicals of the world. And so we're starting to do some really exciting work there to help patients kind of have that more concierge experience around getting virtual care, getting access to all your health system resources, labs, imaging specialists, getting access to um, um, uh, questions through our chatbot, for example, um, and putting that all in one tightly integrated offering that makes it easy for them to sort of stand up that line of business, for example. So we're going to continue, I think, leaning in with our customer base, hearing from them around the things that they need, but then also trying to sort of, which again is a pretty diverse customer base at this point, just given all the markets that we serve. Um, but then also, continuing to sort of lean in on where we're seeing great opportunities to create good consumer great experiences in healthcare, because most of the stuff that you use in healthcare doesn't feel like Uber or Spotify. It feels like, you know, something from a decade or two ago. Um,
Or
and
five.
yeah, or five. I was trying to be gracious with that,
You
but
can be
yeah,
you can
you're
be
right.
polite to your customers. They have been trying for a while, but I mean, it's still a business, which without question depends on the relationship between the doctors and the surgeons who steer in the high profile patients and accessing. And they've been for years buying primary care doctors to try to get them to steer in their referrals. And a lot of what you're talking about is what they call leakage, right? Whereas if you can help fix the consumer experience, you should be able to deliver a lot more patients care within the four walls or the virtual four walls of the hospital, and that's obviously the position that you're helping. Makes a lot of
And,
sense.
and that brings up a good point. I think when we first started the company going into the emergency department, it you walk into most ERs in the United States, and there's like 140 million ER visits in the United States every year, by way of example. It still feels like the internet doesn't exist. Like patients are just, you go in there, you check in at the front desk, you're sitting in the waiting room for hours sometimes. And, so just giving patients the ability to go through and do their whole nurse intake on their phone, give them transparency around what's happening next, give them the ability to sign their discharge paperwork on their phone, give them the ability to schedule their follow-up appointments or do, all of that was, again, kind of um, sometimes it's good to kind of come in with that outsider perspective because, you know, in healthcare, I know there are a lot of attempts at kind of making that experience better. But I think doing that in a way that actually saves time for the physician, saves times for the nurses, um, reduces bounce backs, all that sort of stuff coming together is a lot of orchestration. And again, we were very fortunate to work with a couple of health system design partners initially to go build that. But I think for us as outsiders, we had to really go sit in the waiting room. We had to go shadow the nurses, shadow the physicians, really go spend time bringing our engineers and product managers and designers to the front line to go observe. And I think, kind of going back to the Summa example, I think there's like a million examples of being able to go do that in every part of healthcare. And so that's why I'm really excited about, what GC and others are probably going to go do in that space.
Yeah, I think that's a great place to end because a lot of healthcare innovation has to come from why are you doing with that? And the poor clinician going, I don't know. It's just what we've always done. And I think there are a lot of things that can be changed, a lot of examples from the outside to be used. And hopefully companies like yours will help encourage that process because, like I said, whenever you talk to people or consumers or patients about it, no one's having the greatest time. All right, we'll end it there. I've been talking with Aniq Rahman. He's the CEO of Fabric. Aniq, thanks for your time. Good to hear what you guys are up to.
Thank you, Matthew. It's a pleasure to be on.